Hello, I'm Susanna Hopsalarin, Senior Editor with Hospitals and Health Networks magazine. Today I'm reporting from HIMSS 2016. I have here with me Dr. John Halamka, CIO from Beth Israel Deaconess Medical Center. He just delivered the keynote speech on Health IT's report card at the AMDIS HIMSS Physicians IT Symposium. Where are we right now with this report card?
Well, sure. I looked at EHRs, I looked at interoperability, I looked at patient-family engagement and said, we can do better. EHRs have an overwhelming burden of data entry for clinicians. Doctors aren't working at the top of their license. If we can spread the effort, doctors, nurses, pharmacists, social workers, patients, and families entering data, that will certainly help with some of the physician burnout issues we're facing. If on the interoperability side we embrace some new standards, a new standard is coming that is much closer to the Facebook and Amazon approach than the what I'll call legacy standards of the past. That will make new products and services available, especially those on mobile platforms. If patients and families can send us their data, can tell us their symptoms, can tell us how they're doing, we'll be much better able to measure outcomes, which is critical for a world going from fee-for-service to alternative payment models. So I think at the moment we're at about a B-, but there's hope.
And as we're moving towards the outcomes-based payment models, when you're looking at the data that's available for care coordination, does the physician really have all the information he or she needs?
So let me give you a personal example. And don't worry, there are no HIPAA issues here. We have complete consent. My father died 2 years ago of multiple sclerosis. He was on every bioengineered drug possible. So you ask him from a process perspective, did he receive medications? Absolutely. But did he walk? Was he in pain? Was he feeling good? What was his mood? What was his flexibility? Those are measures of outcomes. Just getting a medicine prescribed is a measure of process. So in fact, what I found was my father was actually given drugs such that the symptoms were worse than the disease. That he in fact needed less drugs. So the process, though following a guideline, had a bad outcome, and there was no way a doctor could measure that. Now, his phone, of course, told us how many steps he was taking. If his phone was able to ask him a question, how do you feel? Give me a smiley face or a sad face, that would have been the data we needed.
And from the patient's perspective, what does the patient really need from us, and what can we offer and change to fulfill that expectation?
Each of us has different care preferences. So for example, I've told my wife, if I am no longer able to do the things that bring me joy, run a farm, write a blog, I don't want to be kept on a ventilator. You know, my outcome desire is palliation, pain-free, having joy in life. And so we need to make sure that we combine the doctor's expertise, the objective data and the subjective data from the patient and their care preferences to achieve a respectful outcome, which may be different for every person.
Thank you, Dr. Halamka. I'm Susanna Hopsalarin from HNHN.